Hello guys, I welcome all of you to today's session on endocrinology. As you can see, we have already reached the 7th week, and today our topic of discussion would be endocrinology. And guys, I'll begin premiering this not on Sunday, because on Sunday I will be in a class which will end beyond 9 o'clock, 9:30. So I'll premiere it on Monday, coming Monday, for endocrinology, 9 o'clock. And week by week, guys, we had been covering one topic after another, and today, by completing endocrinology, we'll be almost done with, I can say, 75% of pharma. Rest 25% will cover up in the next 3 to 4 weeks. And let's begin with today's session, guys. All right, so coming to the first question itself, look at the question, guys. A decrease in cardiovascular mortality and heart failure can be seen with. Now look at the options: A, B, C, D, pioglitazone, liraglutide, canagliflozin, metformin. So all of you know that diabetes is an important topic. They will ask at least one MCQ from diabetes. So I have made a new MCQ. So, in these sessions, right, I don't discuss PYQs and all, because how much will you discuss PYQs? So I make all new questions, right? So guys, look at these options. Let me know the answer in the comment box. All of you must comment, guys. All of you must participate. So guys, what do you think, guys, is the answer here? Is it pioglitazone? Is it liraglutide? Is it canagliflozin? Or is it metformin? What do you think, guys, is the answer here? All right, some of you guys might jump onto pioglitazone looking at heart failure, but it is not the answer. See, that is about decrease, not about increase. Pioglitazone's side effect is heart failure, so it's not the answer, right? All right, liraglutide. Well, if you answer liraglutide, you are partially right, because it does decrease CVS mortality, right? Canagliflozin. So in fact, all these three drugs, they decrease CVS mortality, is true for liraglutide, canagliflozin, metformin. But one thing where the answer will change, it is with respect to which one can also decrease heart failure. Which one is that? So can you at least now comment, is it B, C, or D? Guys, your answer is canagliflozin, because they also decrease hospitalizations related to heart failure. Now, how do they probably do that? Because see, these are drugs which are SGLT2 inhibitors. That means they will increase excretion of sodium and glucose. Both are osmotic in nature. So they will also increase excretion of water. So sodium and water, both excretion increase, that can decrease the blood volume. Plus, they can also decrease blood pressure. So the reason probably why they can be good in heart failure is because they have the ability to decrease blood volume. So this is again a new MCQ that I made. And if you marked B, C, or D, that is still pardonable. But if you marked A, that's a grave mistake. A is not the answer here. So C is the answer, guys. So we learned something new, right? All right, moving on to the next question, guys. A patient of psychosis who did not respond to multiple drugs was started on clozapine, which led to significant weight gain. So all of you know, clozapine is the atypical antipsychotic which causes maximum weight gain. Which of the following drugs specifically indicated in this patient, right? Semaglutide, glipizide, pramlintide, metformin. I guess take some time, ponder upon the options. Let me know in the comment box. Let me know the answer in the comment box. Come on. All of you guys must comment the answer in the comment box. What do you guys think is the answer here? Is it A, is it B, is it C, or is it D? Come on, guys, think. What is the answer? All right. If you look at these drugs, let us talk about the relation to weight. Semaglutide causes weight loss. It's used in obesity, right? It's a sulfonylurea, and they cause weight gain. Pramlintide, metformin, these can cause weight loss. So again, I can rule out that is B. So my answer can be A, C, or D, right? I learned something new here today. What is the drug that is used for treatment of antipsychotic associated weight gain? What is the answer here, guys? Now, even if you don't know the answer, I've given you three options, right? Can you make a wild guess? Just make a wild guess. What we have read in antipsychotics, you can correlate something. I told you, antipsychotics, they can cause metabolic side effects. And those metabolic side effects, one of them is hyperglycemia due to insulin resistance. Plus, they can cause obesity. Now, does it ring a bell? From this, at least, can you make a guess? What is the answer? Guys, our answer is metformin. Metformin, see, semaglutide, if they ask you what is the drug of choice for obesity, then your answer would be obviously semaglutide. And it is used by oral route, right? Once a day by oral route. But antipsychotics induce weight gain. One of the anti-diabetic drugs that is used is metformin, right? So if you didn't know this, just add this to your notes, right? Now moving on, guys. Next question is, a 66-year-old patient was diagnosed with type 2 diabetes mellitus. The patient had been suffering from chronic obstructive pulmonary disease for 6 years and hypertension for 4 years. His current therapy includes tiotropium, obviously for COPD, enalapril for hypertension. Which of the following anti-diabetic drug would be relatively contraindicated in this patient? Acarbose, metformin, sitagliptin, glyburide. Go through the options, these 4 options. Okay, so I made these options as red as well. It should be black, right? So it's my part, my problem in editing. Anyways, look at these 4 options and let me know what could be the answer here. A, B, C, or D. I've taught you this. This is not a difficult one. It's a very easy one, right? Yes, so here answer is B. All of you know that metformin, it can cause lactic acidosis. That's a grave side effect. So any condition in my body that can increase the risk of lactic acidosis, for example, a disease like COPD. Why do you think in COPD the patient is pale? The lips are blue, the nails are blue. Is because of hypoxia. And whenever there is hypoxia, there would be anaerobic glycolysis, and that leads to production of what? Lactic acid. So, any severe lung disease, liver failure, renal failure, chronic alcoholics, all of these are conditions which can increase risk of lactic acidosis, and these are the contraindications to the use of metformin, right? So, metformin acts upon metabolism, met for metabolism, lactic acidosis, right? Now moving on to the next question. A school teacher suffering from diabetes mellitus delayed his breakfast on day of 15th August due to preparation for the function. After some time, he developed uneasiness, dizziness, and sweating. Which of the following drugs the patient might have taken in the morning, right? Look at the options. This is not a difficult one. This has been asked many times. Option A, metformin, B, pioglitazone, C, glyburide, D, acarbose. So first of all, what is the answer? So what do you think is the answer? Let me know the answer in the comment box. Let me know the answer in the comment box, guys. So all of you, come on. All of you must comment. Is it A, B, C, or D? So basically what has happened in this patient is hypoglycemia. So what we can predict here is that the patient is suffering from diabetes. He took anti-diabetic tablet in the morning, but he skipped his breakfast and he develops hypoglycemia. Which of these drugs can cause hypoglycemia? So I've told you guys, hypoglycemia to happen, the drug must be insulin or the drug must release insulin. So sulfonylureas. So any drug that ends with ride or zide is a sulfonylurea. Glyburide, glimepiride, glyclazide, glipizide. So ride or zide. Or any drug that ends with glutide. Liraglutide, semaglutide, albiglutide, dulaglutide. So these glutides, ride or zide. These are usually used. There are some other drugs, but they have lesser risk of hypoglycemia. So at least, can you remember Whenever they ask hypoglycemia, is obvious, they'll not give you insulin. Though maximum risk of hypoglycemia is present with insulin. So whenever they ask, they'll give you either a ride or glutide. So now see, the answer is simple. At least now, guys, can you comment? Let me know the answer. The answer is glyburide. Yes, it's a simple MCQ. If you remember this basic concept that I've taught you guys, drugs ending with ride, or glutide, they will end up causing hypoglycemia. All right, moving on to the next question. A 55-year-old patient was brought to the emergency with altered mental status. On history taking, his son said that he was taking levothyroxine, but stopped 2 years back and is taking some herbs now. His BP is 90/60, heart rate is 56, serum sodium is 120, blood glucose is 67, and emergency treatment was started that included intravenous injection of. All right, so look at the options A, B, C, D: levothyroxine, liothyronine, levothyroxine followed by liothyronine, liothyronine followed by levothyroxine, right? So I don't think any one of you would have any difficulty in making a diagnosis here, because the diagnosis is plum. The diagnosis is plum, which is mixed edema coma. The diagnosis is plum, is mixed edema coma. But the answer is not easy. What is the answer, guys? What is the answer? What is the answer? All right. If you'll answer either A or B, your answer would be wrong. A and B is not right. So the answer can be either C or D. At least can you comment and let me know now? I just want to know what do you guys think. Is it C or D? Should I give levothyroxine first, then liothyronine? Or should I give liothyronine first and then levothyroxine? What do you think? What do you think I should do here? Now, if you answer option D, it would be an innocent answer. You might think that T3 is the active form. Let me give it first, followed by levothyroxine. That is not the logic, guys. Here, we first give levothyroxine, followed by liothyronine. And both are given by which route? Intravenous route. And we also give oral after that, once the patient is stabilized. So remember, mixed edema coma is not that common nowadays. Rarely can be seen. The treatment is T4 supplement followed by T3 supplement, right? Levothyroxine followed by liothyronine. So this I made on clinical MCQ on mixed edema coma. Now let's have a look at next question. A 57-year-old man suffering from asthma was admitted to the hospital with nausea and vomiting, right? Extreme restlessness, insomnia, tremor, mental confusion, and fever. He also has increased hunger, dyspnea and exhaustion, palpitation, diarrhea. Lab examination FT4 is very high, and TSH is nowhere to be found, undetectable, right? What is the initial aim of the treating physician? So, my dear physicians, what is that you want to do here? Come on, guys. Is it A, decrease T3-D4 synthesis? Is it B, block release of T3-D4? Is it C, block AV node? Is it D, stimulate calcium channels? A similar MCQ has already been asked in your NEETPG. Last NEETPG they had asked. I've just changed the MCQ. Okay, so that is the reason why only doing PYQs will get you nowhere. So you should know the topic. If you know the topic, you'll land on the answer here. I guess let me know. So all of you know what's happening here. I have no doubt all of you guys must have made a correct diagnosis here, that what we are dealing here with is a patient of thyroid storm. What we are dealing here is with a patient of thyroid storm. So it's a patient of thyroid storm. Is a patient of thyroid storm. All right. What is that I worry in a patient of thyroid storm? Thyroid storm can cause atrial fibrillation, which can get converted into ventricular fibrillation, and that can kill the patient. So basically, my first aim is here to prevent conversion of atrial fibrillation into ventricular fibrillation. What should I block here? I must block the AV node. So the answer here is block of AV node. Anyways, here they had given you drugs, and in those drugs, your answer was diltiazem. So if you would have gone for calcium channels just because the answer was diltiazem, then it means you have fallen prey to PYQ, stuffs. So I block calcium channels. I do not stimulate calcium channels, right? To block AV node, right? So to block AV node. All right, guys. So this is an interesting MCQ. Now moving on to the next question. Which of the following drug that can inhibit peripheral conversion of T4 to T3 has a role in treatment of thyroid storm? Again, I've made this a new MCQ, brand new MCQ. You'll not find it anywhere. Methimazole, hydrocortisone, Lugol's iodine, amiodarone, right? Which of the following drug that can inhibit peripheral conversion of T4 to T3 has a role in treatment of thyroid storm? Has methimazole any effect, or is it ever used in thyroid storm? No. Neither it converts nor it is used. Hydrocortisone. Okay, if I don't know the answer, let me leave it for the time being. Right, so no for both. It is no for both. Neither it can inhibit peripheral conversion nor it has a role. Lugol's iodine, no for the first part. That is, it cannot inhibit peripheral conversion of T4 to T3. But yes, for the second part, it can be used. In thyroid storm, it is one of the options we have. I can use it, yes. Do I use it commonly? No, but I can use it. So again, so C will not be the answer. Amiodarone, the first part, can inhibit peripheral conversion of T4 to T3, yes. But is it used in thyroid storm? No, right? So I know it's a difficult MCQ. I've made it deliberately so that you guys can scratch your head, right? So what is left? Hydrocortisone. Now you cannot complain that I've not told you this. I've told you guys this. Which of the following drug inhibits peripheral conversion of T4 to T3? I've told you propylthiouracil, beta blocker, amiodarone, steroids, right? So steroids, hydrocortisone is the answer, guys. So here you could have ruled out. You could have ruled out option A and D. A is not there, you could have ruled out. D, you could have ruled out. Now you would have left with B and C. And even if you don't know, just pray to God and go for one option. I have to attempt such MCQs. I have to attempt such MCQs, right? Which of the following steroid should be chosen in a patient of hypertension with an inflammatory disorder? Chosen in a patient of hypertension with an inflammatory disorder. So suppose the patient has an inflammatory disorder like inflammatory bowel disorder or rheumatoid arthritis or gout. I've not specified the disease. That is not the aim here. Look at the options. Prednisolone, hydrocortisone, prednisone, triamcinolone. I've taught you this. This is application of what I have taught you. Because, nowadays I've told you how the MCQs are going to be asked, where you're going to apply the knowledge that you get in the lectures, right? So mugging up and vomiting is not an option nowadays. So look at the options A, B, C, and D. What do you guys think is the answer here? Come on, let me know the answer in the comment box. Whatever you think is the answer, let me know in the comment box. So guys, here, see, normally, steroids, they have glucocorticoid and mineralocorticoid effect. So to suppress inflammation or to suppress immunity, what is important is the glucocorticoid effect. Whereas mineralocorticoid effect, it will cause sodium and water retention. Now this can increase blood pressure. Now those steroids which have both these effects are prednisone, methylprednisolone, hydrocortisone. But those, so the answer here is triamcinolone. But those which have glucocorticoid effect only, or I've taught you this, these are also known as pure glucocorticoids. So they would have a minimal effect on blood pressure, right? So if they ask you, so I'm not saying they'll not have any effect, they'll have very minimal effect, right? So because I told you, selectivity in pharma is never absolute, it is relative. They're relatively more selective for glucocorticoid receptors. So here, crux of the matter is, whenever our patient where high blood pressure can be detrimental, in that case, I would rather go for triamcinolone, dexa, or betamethasone. So this is not something new. I've told you this. All right. 120 milligrams of methylprednisolone is equal to how many milligrams of dexamethasone? This is not pharma. This is mathematics. Right? So let me teach you a little bit of mathematics. Okay. Make some calculations, guys. Quick. Do some calculation in your mind. If you have a pen and paper, do that. But in exam, you'll not have pen and paper. So anyways, let me know what is the answer here. Calculate. Let us see how good you guys are at maths, right? How good are you guys? All right, methylprednisolone. See, if I take the hydrocortisone potency to be 1, methylprednisolone's potency is around 5, and dexamethasone potency is around 30, right? So if I compare, so if I look at dexamethasone, it is 6 times more potent than methylprednisolone. So if I'm giving dexamethasone, I'll give 6 times less. That means I have to divide 120 by 6. That comes out to be how much? 20. Now, if you did not get the answer, then you need to search a teacher of mathematics because I'm not a teacher of mathematics. This is pure mathematics. It is 6 times more. I have to divide it by 6. I get the dose as 20 milligrams. Anyway, so why I have made this MCQ? The reason being, this is something you're gonna do tomorrow as clinicians. So when you become a clinician, sometimes you'll make a switch from one steroid to another steroid. For example, the patient was admitted and you're giving him IV methylprednisolone, and when you will wean off and you might like to prescribe dexamethasone because it has lesser effect on blood pressure, you cannot prescribe the same dose of methylprednisolone he was on. You have to decrease the dose. And how am I going to do that? By dividing a number that is 6, right? Oh my God, such a long MCQ. Anyways, let us see. A 45-year-old patient was brought to the emergency with high-grade fever, chills, and difficulty breathing. He was immediately intubated and put on ventilator. A chest X-ray was done which showed bilateral patchy alveolar infiltrates. The patient was started empirically on levofloxacin and azithromycin for bacterial pneumonia, but after 1 day there was no change in the sprayed on infiltrates. A bronchoscopy with bronchoalveolar lavage was done and differential cell count of a lava specimen around 33% eosinophils. This is the catchword. This will give you the answer. The patient should be started on. All right, is not responding to antibiotics or antibacterial drugs, so to say, right? And then there are eosinophils. It will not happen in a bacterial pneumonia. You'll find rather neutrophils, right? Eosinophils are marker of what? Allergy. So what is the diagnosis here? ABPA, allergic bronchopulmonary aspergillosis. Then how do I treat ABPA? See, the drug of choice in ABPA, these are steroids like prednisolone. Plus, I also combine itraconazole, because if I combine itraconazole, I will need lesser dose of steroid. And is it a good thing or bad thing? Obviously, it's a good thing. Lesser dose of steroid means lesser toxicity to the body. So, an answer is itraconazole plus prednisolone, guys. Itraconazole plus prednisolone. Now, moving on to the next question, guys. A 67-year-old patient was brought to the emergency with altered sensorium and dehydration. The patient had undergone radical prostatectomy for prostate cancer 3 months back. Serum calcium is high, ALP is high. Which of the following drugs can cause most rapid decline in patient's serum calcium level? Hypercalcemia of malignancy is the diagnosis. Hypercalcemia of malignancy. A zoledronate, B hydrochlorothiazide, C calcitonin, D denosumab. Guys, what is the answer? Please let me know the answer in the comment box. What is the answer, guys? Come on. Please let me know the answer in the comment box. What is the answer? What is the answer here? Yes, guys, what is the answer? All right. So if I look at this, I know some of you guys must have answered zoledronate. I have this much of experience, I know that. If I was a student in your place, even I would have gone for zoledronate because I would not have known the answer. So zoledronate is not a bad answer, it's a good answer. But every good answer is not correct. It's not right. Zoledronate is not right. Your answer is calcitonin. So remember, a maximum decrease in calcium level or maximum hypocalcemia can be caused by bisphosphonates, but a fastest decrease in calcium or fastest hypocalcemia can be caused by calcitonin, right? So maximum, fastest, these are two different things. Maximum and fastest, these are two different things. So that is the reason why the answer is calcitonin. Now look at the next question, guys. A 56-year-old woman presented to the OPD with persistent back pain for the past 1 week. Dual energy X-ray absorptiometry showed diffuse osteoporosis of the spine and hips, and she is a case of very high risk of fracture. The physician prescribed calcium and vitamin D supplementation and alendronate, 1 tablet daily. Despite following the advice of doctor, she still developed esophagitis. Alendronate should be stopped and the patient should be started on. All right. This is a clinical case. Denosumab, raloxifene, calcitonin, romosozumab. Now remember, post-menopausal osteoporosis. Drug of choice are bisphosphonates. Now, if there is intolerance, then I look at the risk of fracture. So what is the risk of fracture? See, the risk of fracture, it can be high or it can be very high. If the risk of fracture is high, I go for denosumab. If the risk of fracture is very high, either I go for romosozumab or I go for teriparatide. So these are two anabolic drugs, all of you know that, right? So this is treatment of post-menopausal osteoporosis. High risk of fracture, very high risk of fracture. These are things which I decide taking into mind various factors like the bone skin, etc., right? Or the risk of fracture, etc. So the answer here, right, what is the answer now? What is the risk of fracture? Very high risk of fracture. So what is the answer? Romosozumab is a new drug approved in 2021. It is a blocker of sclerostin, right? All right. A patient was started on pegvisomant for treatment of acromegaly. All of the following should be monitored except. A patient was started on pegvisomant for treatment of acromegaly. All of the following should be monitored except adenoma size, LFT, IGF-1, growth hormone. What is the answer? It's a difficult one, I know, but it is a clinical MCQ. I told you in these sessions, I'll discuss a lot of clinical questions which are important. That is what is being asked nowadays. All of you know that. So my aim is not to prepare you for an easy exam. Rather, I'm doing these sessions so that I can prepare you for the difficult exams, right? The tough ones if they come. All right. So whenever I give pegvisomant, it can increase the size of the somatotrope adenoma. So adenoma size should be monitored. Yes. So I should do MRI to regularly monitor. LFT is a hepatotoxic drug. So yes, I should monitor. IGF-1, yes, I should monitor because that is what we regularly monitor to look at the response of drugs used in case of acromegaly. Now, growth hormone is the answer. Why? See, what is pegvisomant? It is a growth hormone receptor blocker. So it blocks growth hormone receptor and it has no effect. It has no effect on growth hormone whatsoever. So what is the point of monitoring growth hormone? Now this MCQ at the outset, it might seem difficult, but sometimes you don't know the answer, but you can apply a basic logic and you'll have a gut feeling that probably growth hormone is the answer. You should go for the answer in such MCQs because you have to leverage, right? A student messaged me, sir, I'm not getting good rank in the grand test. I asked him a simple question. Out of 200, how many MCQs are you attempting? And he told me, do you know the number? He said me, how much? 120. I said, then you have the answer yourself. How can you attempt only 120? You have to maximize your attempts to 170, 180. Then he told me, sir, I feel guilty answering those MCQs where I don't know the answer at all. Now, this is something you have to practice, right? Even where you don't know the answer, you have to make a guess. And when I say a guess, it means an educated guess. It is not like Ata, Bata, and Sata, and which one is. No, it's not like that, right? You're not going to play roulette with those MCQs and options, right? So you have to make an educated guess, and MCQ by MCQ, test by test, you need to hone this skill of making correct guesses, right? So towards the exam, my aim should be to make more correct guess as compared to incorrect guess. So plus minus, I would still end up getting good number of positive numbers, right? So answer is growth hormone, guys. All right, moving on to the next question. A patient from Canada flew to India for gender change surgery. He was supposed to be started on which drug after surgery? So all of you know, this is an MCQ that I made on current affairs, right? So I know we are not having an IS exam, but anyways, this is something happening in Canada, right? In Canada, it's like an epidemic. Males want to become females, females want to become males. And don't get me wrong, I'm not against anyone becoming a gay or changing gender. I'm all for freedom of expression, and whatever a person wants to do, it is his or her personal choice. But the problem happens when it becomes a propaganda, and that is what is happening in the West now. And we are still, I mean, it's not that much in India now, but the spillover effects of the West, it does come to India as well. So be prepared for such kind of MCQs in our exams in the coming times. All right, coming back to the MCQs. So let us learn back from Canada to India. Leuprolide, finasteride, flutamide, letrozole. What is the answer, guys? What is the answer? What is the answer? Now, this is something I have not taught you guys. Gender change surgery, I don't teach. For a simple reason, you know. I mean, there is not something so much talked about in India now. Though gender change surgeries, they happen in India, but it's not a propaganda as of now. So, leuprolide, finasteride, flutamide, letrozole, what would be the answer? So guys, here, if you don't know the answer, let me tell you what's going to happen here. And it's a he, and he wants to become she. Okay, he wants to be, so I get confused. So, okay, the patient is he, and he wants to become she. Okay. And for he to become she, what I need to do is I need to decrease LH and FSH. Now, which are the hormones essentially which makes us male and female? These are estrogen, progesterone, testosterone, and they are synthesized by LH and FSH. And that is the reason why in this he will start the he on leuprolide to make him she, right? So leuprolide, it's a GnRH agonist. I'll give it by continuous dosing, and that would decrease LH and FSH. So it is commonly used. It is commonly used. In fact, the gender change, this menace that is going on in Canada now, it is thought that all of these charade has been sponsored by the drug company which makes leuprolide. I don't know how much it is true. I've just heard in some YouTube videos that the company which makes leuprolide, probably they are behind all of this. Anyways, because you know, one gender change surgery in Canada, the hospital bill is around $1 million. Yes, 1 million means 8 crore rupees, right? Digest that. All right, moving on. A patient was given tamoxifen for treatment of breast cancer treatment. Which of the following advice should be given to the patient? Which of the following advice should be given to the patient? Drink plenty of water, avoid direct contact with sunlight, avoid prolonged periods of immobilizations, avoid ice pack for hot flashes. It's again a clinical MCQ which I've given you. It's a new MCQ. You'll not find anywhere this question. I made it so that I can test your clinical in-depth knowledge, right? And this is the last MCQ for today, guys. All right, come on. So this is the last MCQ. Don't hold yourself back. Pour in the comments as much as you can. Let the comments flow. Let the comments flow like water. All right. You know that thrombosis is a complication of tamoxifen, and that can lead to DVT or deep vein thrombosis. When is the likelihood of DVT more? Whenever the patient has prolonged periods of immobilization. So I'll ask the patient to avoid prolonged periods of immobilization, right? So, I have done this myself. I myself had prolonged period of immobilizations. And when was that period of immobilizations with me? When I started watching Game of Thrones. I was late to catch up. It was already season 5, I think, or 6. And that is when I was introduced to Game of Thrones. And initially, I was like, what the hell is this? Seven Kingdoms, this, that, Lannister. So it is very difficult to put my head through. But once I was into it, I was lost. I was lost in Westeros, right? I was lost, and I felt as if I am also one of those characters, and I would binge watch for 5 hours, 6 hours in the same position without moving. And there is a time when I used to get up, 6 o'clock in the morning. But after watching Game of Thrones, I would sleep at 6 o'clock in the morning. 6 o'clock in the morning. That is how it has changed me. Anyways, jokes apart, coming to the answer, avoid prolonged period of immobilization. That is the correct answer here, guys. So, guys, these are the 15 questions, brand new questions, a lot of clinical questions I had included in this session. Our aim here was to solve some MCQs, good ones from the topic of endocrinology. And by now we are done with endocrinology. The topic for next week, that is from Monday to next Saturday, I'll post on Sunday evening, both on Instagram as well as I'll post on YouTube as well. So keep following that. And if you have been doing all of this till this week, then kudos to you. If any one of you guys, if you had been able to do this from day one till now, it talks a lot about your character, right? How character of a steel you have, right? Patience, you have a strong patience. And this patience is something that does not come overnight. We need to develop it gradually. This discipline is something that will keep us going forward till the exam, and keep preparing. Before INICET, we'll be over with this. And the day you go and appear for INICET, if you have followed this, that day you will understand what is the power of weekly pharmacology. And that is the reason I know the power, because I've done this myself as a student. So that is the reason why I've done this power. I have advised this to students time and again earlier, and I've seen how the ranks have improved. One student, his rank improved from 6,000 to rank 60. Imagine that, 6,000 rank to 60, just because he did this, not only in pharma, but all 19 subjects. He did this because he had all the notes. He appeared for the exam once. It was in 2014, I think. He wanted orthopedics, 6,000 rank, orthopedics is not possible. So he said, sir, I have a lot of time, but I have done everything that possibly one could do. Still, my rank is not improving. It's still around 6,000. So I told him, read, revise, re-revise, read, revise, re-revise, and bang on, rank 60. He has already completed his orthopedics. He's from Tamil Nadu, Chennai, and is a practicing consultant now, orthopedics, right? Small things make a big difference. I guess I'll see you next week with the next topic on the other side. All the best for the next week. I hope you guys are gonna rock. So guys, lots of love and blessings to all of you guys.